please mute yourselves as you enter the meeting, everyone. Thank you. Hi, Jenny. Please mute your microphone until it's your time to talk.
Okay, will do. Can you hear me?
Yes, very well.
Great, thank you.
Mark, can you hear me?
Yes, but you have some feedback.
I don't know how to not have that. Okay.
Are you on a phone and a computer?
Well, I dialed in. Yeah, I can hear that too. I called in on the phone, but I have the picture up on my computer, but supposedly on my computer, there's no...
Mute your sound on the computer. It should be fine.
I can't mute my sound on the computer. It says no microphone is found among your devices, so I may just have to hang up and not watch it on the screen.
No, just turn down.
You can turn down the volume on your computer all the way. It doesn't necessarily have to be the mic, but you can just turn the volume down all the way. Sorry, this is Araceli. I'm listening in.
Thanks, Araceli.
Okay.
Mm-hmm.
Is that...
Yes.
See,
That's better. Thanks, Michelle.
But I can still hear it. I can even hear myself sigh. All right, I can hear it. You guys can't hear that echo?
Yes, actually we can.
All right, I'm just gonna not be able to watch it. Something doesn't work with my, like I can see the mic, but I can't, it's like, it's blacked out. And it even says no microphone was found, so I don't have a way to turn it off. I can't even mute my screen, my keyboard.
All right, well, just mute yourself. Oh, you mean on the screen, mute yourself right now. Okay, great.
The only way to mute myself is on my phone.
Hey, Mark, are people going to join us, or are you gating that?
People have already joined, Dr.
Okay.
Okay. And whenever you or Mr. Wagner want to go, it's up to you. I think Greg's going first, but whatever you all want to do.
No, I was going to go first and provide a context, and then Greg would go.
Okay.
And then I think we will have questions through you. Is that correct?
Yes.
Okay. I think we'll give people a few more minutes to join.
Sure. It's 1:01 now, so let's wait maybe till 1:04. 3-4 minutes.
Perfect.
everyone who's not presenting in the moment, please mute your microphone. Thank you.
So, Mark, I'm going to start. So, good afternoon, everybody. Welcome to our DPH CBO Partners meeting. Given our many challenges in our timeline, we thought it was very important to communicate virtually where things stand with regard to our budget, to answer questions that you may have. I really want to thank Greg Wagner, Jenny Louie, and their team for working so hard to meet an unprecedented budget timeline. I also want to start by acknowledging the unprecedented protest against systemic and structural racism that we are witnessing across the world, across the country, and in our city, and to let people know on this call that DPH is offering guidelines on how to protest more safely, and we are also offering free testing to people who have participated in the protest. We've scaled up a testing site at St. Mary's Cathedral, and we can provide you both those guidelines and information on that testing if that's something that you or your organizations, and certainly the people that that you deliver services to could use. These are unprecedented times, both with regard to the protest, obviously with the pandemic as well, and these issues obviously intersect with regard to health and wellness, and the DPH wants to make sure that people hear our support for the cause, and that we are also ensuring that there's support for people to demonstrate more peacefully in terms of the guidelines, and then to get tested if they so feel the need to do so. I have a few slides with regard to where we stand with regard to our pandemic response, and I'll go through those quickly. I think they're going to come up. Is that correct, Mark?
Yes.
Yeah.
It's coming up.
Here we go. So these are from our COVID-19 dashboard, the citywide dashboard, and some of you on the Zoom call may look at these on a regular basis, but just to ensure we're all on the same page in terms of our understanding. We currently have almost 2,800 cases of COVID-19 confirmed in the city. These are people who have been tested, so it doesn't represent all the cases, the diagnosed cases. And also remember that most of the people of this number have recovered and are not infectious. In general, 2 to 3 weeks of recovery and infectiousness. So really the last 2 weeks, 2 to 3 weeks are represent the people again who are either sick from COVID-19 is too many. I will say though that we haven't had a death since the 25th. And one of the things that is increasingly clear with our relatively low numbers of COVID-19 in the city, our medical institutions have been able to really learn and strengthen the medical care for people who are in the hospital. Next slide. This is our dashboard in terms of our diagnosed cases and the testing rates. And you can see here that I'll point you to the gray bars with the jagged green line. Those are the number of tests done a day in San Francisco. We have dramatically increased our testing rates. We're at an average over the last 7 days of over 2,000 tests a day. That last little blip at the end of that line, don't pay too much attention to that because that's simply a reporting lag in terms of the number of tests done. So really have scaled up our testing, strengthened our testing supply, and many of you on this call have helped us do that. So I want to thank you, and we'll continue to expand our testing ability. The positivity rate, you can see over time has been 4%. And we've done a total of almost 84,000 tests in the city as we move towards a vision of realizing our vision for universal access to COVID-19 testing for the whole city. With regard to cases by race and ethnicity, one of the key things that stands out here is the preponderance or the inequity with regard to COVID-19 diagnoses among the Latinx population. A staggering 48%, 48.7% of our COVID-19 diagnoses are among the Latinx population. And you can see that there are other inequities as well, including with regard to the proportion of Black African Americans who have been tested. And then this isn't shown on the slide, but with regard to our deaths, we have had a higher proportion of Asians die from the disease compared to representation in San Francisco overall. We're working on multiple levels to address the inequities that are demonstrated here. I don't have unfortunately time to go into those details, but many of you are partners in that work going forward, and we can return to that discussion at another time. Next slide, please. This is our curve with regard to hospitalization across the city. This is across our 9 hospital systems in the city from early May to early June. So a month of data here. Just to say that even before that, we reached a peak of about 100 hospitalizations a day in April. And we have seen since then not only a flattening of our hospital curve, but a decrease in the curve. And you can see all the way to June 6th, we're down to a remarkable 36 hospitalizations, 14 in the ICU. The light bars are in the ICU, and the darker green bars are the people in the medical surgical units. The curve continues to decrease and is really remarkable and really reflects the community support for the mayor's actions to shelter in place and our collective aggressive response early in the epidemic. Just to give you some estimates, scientists estimate that if we had delayed shelter in place by just a week in the city, we would have peaked at 400 hospitalizations, and a 2-week delay would have resulted in a peak of 1,600 hospitalizations. So really important that we acted early, and we see that we've truly saved numerous lives in San Francisco as a result of this. Next slide. This is also, this is a slide that shows our rates and deaths by different jurisdictions across the country. You can see here that particularly our death rates, which is what I focus on. Testing and cases per 1,000 depends a lot on testing capacity, but you can see here that fortunately our death rates per 100,000 have been significantly lower. And this really reflects the fact that the healthcare system did not become so overwhelmed by COVID-19 cases that the best medical care was available for people. And we have to be very thoughtful about this moving forward in the event that there is a surge, that we respond effectively to prevent scenarios such as we saw in New York and some of our other East Coast cities. Next slide. This is a slide of what's happening across the region right now. You can see that Alameda has had an increasing number of cases at an increased rate. That's the red line at the top of this slide, so we're watching that very carefully. San Francisco and Santa Clara, again, an increase in cases over time, but a relatively flat curve, which is good. The rate has been pretty consistent. And you see similar rates, similar patterns, excuse me, those somewhat slower rates in Contra Costa and San Mateo. slower overall cases. I'm sorry, the rates are relatively the same, but the number of cases are lower. Next slide. So as we move forward with a gradual reopening of San Francisco, our indicators in terms of measuring and assessing our progress are going to be the number of cases of COVID-19 in the city, our hospital capacity, and the hospital capacity, going back to what I was saying about the ability to care for people in the best way possible, is going to be particularly key. So we will be looking at hospitalization rates of COVID-19, as well as our hospital bed capacity to take care of people. Our testing ability to expand our testing. We've met our goal of 2,000 tests a day. So that's very, very good, but we're going to continue to try to better on that goal going forward. Contact tracing, our goal is to contact 90% of our cases, and then to contact 90% of the people that they report having come into contact with. So a high goal there, but one that we're up to the task, and we've trained scores of people to do this work. And I would also say that this is not just about getting a test and then being contacted by somebody about who you have come into contact with. This is about wraparound services. This is about providing the social services, the behavioral health services, the economic support, so that people will get tested and feel supported in that testing process. And if they do test positive, that they are given everything they need to be supported in that context, and that their families are also being supported. I think this is a particularly important piece for our low-wage workers, where the motivation to test and go into a 2-week quarantine is very much balanced by the need to have a sustainable income and to maintain a job. And in addition, how people are able to engage with family members in their living situation in a way that's safe, versus potentially going into a hotel room where they are able to maintain safer practices. So a lot of work there, but it has to go far beyond sort of our traditional thinking about contact tracing. And the cultural aspects of this are incredibly salient, and we will be asking you for your help in this work. We have about 50% of our contact investigations so far, for instance, have been in monolingual Spanish. So much work to do there and to build out support structures in working particularly with the monolingual Spanish-speaking communities and other communities as well. And then we are also continuing to focus on personal protective equipment, or PPE, the facial coverings in particular, as we move forward to this gradual reopening stage, ensuring that people understand and support each other in wearing facial coverings. As you know, masks are primarily wearing a mask protects other people around you, and they're wearing a mask protects you. So we're really focusing on this as a key intervention going forward for our workforce, for the public in general, as well as social distancing and hygiene, better hygiene for everyone. Next slide. So I won't go into the safe reopening plan in detail. There is a link here. The mayor announced our stages last week. We will be continuing to iterate on those staging timelines and events as we continue to follow the data. But overall, I'm just so proud of what San Francisco has been able to do in response to this pandemic, and it's really because of the strong partnerships with all of you that we've made so much progress. But we are only in the second inning of a long game, and we need to work together in this pandemic response, including as we adjust to a very challenging budget environment, which Greg will now go through, and also want us to ensure that we leave enough time for some discussion and answering any of your questions. Thank you.
Hey, Mark, if you can go to the next slide, please. Thanks. Hi, everyone. This is Jenny Louie. I'm the DPH Budget Director. Just want to spend a few minutes to give you the context for, the budget that we're looking at over the next several years. You probably have seen this slide before in presentations from the Mayor's Office, but basically at a very high level, the scenario that the Mayor's Office and Controller's Office is projecting is one where we would expect a pretty precipitous decline in revenues in sources in the first year, and then continued improvement. We sort of bottom out in the first year, and then we get improvement over the next several years to recover starting in 23, 24. So that first column you see where you see a sharp decline of revenue of 650 million. That's sort of kind of where we see the biggest loss in revenue a year. And then over the next few years, it goes to about 190. So it sort of flattens out. And the reductions aren't as sharp. Just on the uses side, similar to what we've just seen with our regular expenditure trends, we have continued expenditure growth over the 4 years starting in 21, 22. And this is very consistent with just sort of the cost of doing business for the city. And it grows to $1 billion over by the 4th year. So basically, if we took the good news, the sources news, plus the increased expenditure costs over the next 2 years, it's about 750 million on average that they're seeing in terms of losses. And then when you add the 246 million that was expected in 1920, what they're really looking at over the next budget horizon through June 30th, 20, or June 30th, 22 is about $1.7 billion shortfall. Next slide, please. So we've been, the priorities what we've been instructed to do is to meet the general fund reduction requirements. We're supposed to prioritize the core services, and departments are also instructed to evaluate core operations, their current operations, to make sure that they're complying with COVID measures and figure out how we're going to really operate differently in this world of COVID. And then lastly, we're prioritizing services for our most vulnerable populations. All right, next slide, please. And so specifically, our budget reduction targets, we're supposed to propose 10% reduction of general fund for the first year in 2021. It increases by another 5% to a total of 15% in 21-22. And in addition, we need to propose another 5% reduction in the second year as a contingency should they need it if fiscal conditions worsen. So what this means for DPH is that our first year, our general fund reduction target is 75.5 million. It grows to 113.2, and then we need to propose an additional contingency of 37.7 million. On top of this, the deficit didn't include any assumptions for costs related to an ongoing COVID response, and we'll need to look at what those expenditures and revenues will look like in addition to this. Next slide, please. So in terms of our timeline, we're in a pretty crunch state right now because ordinarily, when we get budget instructions, they have about three months to actually develop a proposal and bring it to the Health Commission. But for now, what we're looking at is probably about 3 or 4 weeks for us to develop a proposal and bring it to the Mayor's Office. So the instructions were issued on May 18th. We're having this meeting today. And then by June 16th, we will bring forward our proposal to the Health Commission hearing. We did receive approval from the Mayor's Office to delay our submission, which was originally requested on Friday, June 12th, to June 16th. So we had a chance to bring it to the Commission for their consideration. Once those proposals are submitted to the Mayor's Office, the mayor's office will consider it, and they will submit their proposed balanced budget to the Board of Supervisors on August 1st, at which point the Board of Supervisors Finance Committees will do the review with hearings, and hopefully the budget will be adopted by late September, early October. So it's a pretty tight time frame for what is a significant reduction target and much larger than what we've seen in years past. I think that's all I have. I'm going to turn it over to Greg Wagner, who will talk about financial challenges and opportunities.
All right. Hi, everybody. I wonder why that's echoing.
I think it's
better.
It's better. Yes.
Okay. All right. Hi, everybody. So I wanted to just touch on, we'll get to questions very shortly, but kind of touch on the COVID response. As you heard from Jenny, Louie, this is a big part of our thinking as we're going into budget. And it also really affects our financial strategy and how we're approaching this and how we want to work with our CBO partners on the budget as well to try to get the best outcome that we can. So as Jenny said, in addition to our target, we have a large program that we're going to have to continue to put in place and keep in place to manage the COVID response. And this has budgetary implications as well. So I've got on this slide just a list of some of the things that we've got to work on to continue to manage the COVID-19 response. So that's everything that Dr. Colfax described, the testing, the surveillance, case investigation, et cetera, all the way up to planning for the event of a hospital surge along the lines of what we've seen in other cities in this country and around the world. So this is a big effort and a big program, and what that means is that we are kind of simultaneously being asked to trim our general fund and figure out how we're going to resource this program. So if you can go to the next slide, Mark. One of the things that we're really focused on is how do we match these two together? And I know that some of you have been having conversations with DPH staff and about this topic, but really one of our key strategies for this budget is we don't want to be in a situation where we're cutting our operating budget and then funding new services to meet the COVID epidemic. We want to be in a situation where we are taking our existing resources and using those to match the need under COVID. And what that will allow us to do is, to the maximum extent possible, is avoid doing those kind of deep service cuts that that we all fear, given the deficit that we see in front of us. And so we're asking our CBO partners, our internal divisions, everywhere that we can look for assistance to try to figure out how can we use our existing resources, repurpose them, and orient them towards the work that we're going to need to do in COVID. So examples of that may be if we have a community program or a behavioral health program, how can we work with the provider to direct those resources toward, say, behavioral health services in our hotel program or community outreach related to the COVID program. If we can do that, again, the goal of that is to not have to make those cuts and then add new resources in the COVID program. We would be simply trying to repurpose our existing resources in a way that that maintains our dollars that we're using in partnership with our contract providers. It allows us to keep our civil service programs funded and staffed, but it does require some reorientation. So we're going to be working with you on, we've already started with some of you, and we'll be talking to others about how we think we might be able to do that. Other areas that we're really going to need to focus on are revenue generation. We're looking and we're asking all of you to really help us think through where are any opportunities that we might be able to increase the volume and opportunities for billing, Medi-Cal, other sources. This could include opportunities to draw down funds from the federal stimulus programs that have been passed. We've been receiving money through those, but there are a lot of big question marks. I think one of the big things that this budget is going to turn on is what is the funding relationship between local counties and healthcare providers, and in particularly the federal government. So that goes to revenue generation, but it also goes to this last bullet of partnership on state and federal advocacy. In the citywide planning and including at DPH, there is the possibility for tens of millions of dollars through the CARES Act, the stimulus, through FEMA reimbursement. But there is also a lot of uncertainty about that. We've had a lot of support from our delegations and from our city generally, but that's a big wild card. To the extent that we can continue to get reimbursed for a lot of these COVID response activities, it will really improve our financial situation and our outlook. So those will be some areas that we'll want to continue to work with. We've been building for the last many years a lot of contingency plans for what we knew would happen someday, a big deficit that we knew would happen someday. That day is today. So we have some resources to deal with it, but this is a really big financial challenge, and we're looking to offset as much as we can. I think the degree to which we will have to make service reductions, it depends on all of these factors. How much can we repurpose for COVID? How much revenue can we draw down? And correspondingly, how deep will the level of reductions that is ultimately required to balance the general fund be? Next slide. So a couple of, one before that, Mark, a couple of nuts and bolts issues. I know the Mayor's and Controller's Office covered this in a previous town hall, but for those who hadn't heard, the 2.5% cost of doing business increase that was scheduled for the coming fiscal year is on hold. That is because of the financial situation. So we're not asking, we're asking all of you not to allocate that. And I know that that'll be a conversation in the budget process, but for now, those dollars are not available in the contracts, and they're not appropriated for that use. We are working on the process internally with you and with the Controller's Office to try to ensure that there's no break in funding due to the fact that we have delayed the budget process from the normal June 1st mayor's submission 2 months to the August 1st mayor's submission. So that is our intent, is to keep you stable and working while we go through that interim period and get to final decisions on the budget later this fall. The Controller's Office is working with us, less impactful for DPH, but for more for many departments. They've got a policy and procedure in place to try to extend contracts to avoid any gap. And then lastly, all of you probably are aware that there's a continuity of payment policy that the controller issued that allows us to continue to make payments even where there are declines in service levels due to the shelter in place and the COVID response. I know that is affecting a lot of our CBO partners where we can't operate at the volume that we're used to because of the physical restrictions on either our clients and patients coming to us, or physical separation of people due to the shelter-in-place orders. That extends currently till 6/30/20, but that has over time been tied to the extensions of the shelter-in-place orders. So that is still in place, but that's to be determined how that's going to play out as we go through the budget process. So I'm going to leave it there. Already a little longer than anticipated, but I think we want to go to comments and questions and advice from from all of you.
In order to call in, please use the information on the screen. The access code changed this morning, and we apologize for that. Our citywide DT department changed the system. So I'll quickly verbally say the number and the access code: 408-418-9388, and the access code is 1464192617. You'll press pound twice in order to get onto the line. And actually, when you need to dial *3, not *9 on there in order to get on. We will hold until we get some calls. Araceli, just let us know if and when calls come in.
Of course. So far, no one.
While that call line is in progress, I'll just let folks know that we have a team of DPH folks on the line to respond. We are going to try to both for the items that we hear on this call, and also if you contact us outside of this forum and have a question or a clarification that you need from us, we're going to try to gather that information and distribute it back out through our regular channels to partners. So we'll do our best we can. Also, just will say, we really are, because of the timeline on this budget process, normally what we would normally be doing in a span of about 3.5 months from around Thanksgiving to the end of February. In this circumstance, we're doing in about 3.5 weeks. So it is really compressed timeline, and we're trying to do our best to communicate as well as we can, but we know that is going to be a challenge. But we do want to try to keep in touch and hear from the folks on this call as much as possible as we go through it.
I put the corrected slide on the screen with the *3. Again, that number is 408-418-9388. Access code 146-7004-547.
So I think, Mark, while we are waiting to see if people have questions, I would just iterate a couple of things with regard to the organizations on this call, where we particularly would think about strengthening our work together. With regard to low barrier testing, I think that's a key piece. We've scaled up testing at a number of sites, but thinking about how do we meet people where they are and get people tested. Obviously, there's a long history of doing that well in San Francisco with regard to the HIV epidemic. We didn't do it well all the time, and I don't want us to make those same mistakes. So looking to this group and others for guidance there. I also referred to the contact tracing and the need to put wraparound services as part of that program. I think going back to the facial coverings and the education and the work that could be done there, that's a huge prevention activity. That again, there's work to be done there. And then the intersection, this gets back to what Greg alluded to, the intersection of some of the, much of the COVID or all the COVID pandemic response, so many of the other issues, whether it be the broader health equity challenges that we've been addressing as a department and as a community, the behavioral health issues and how those intersect with our COVID-19 response, particularly with homeless and other vulnerable populations. So there's a lot of overlap here, a lot of potential, and I think a lot of history that of work in the community, with the community, that we need your wisdom, expertise, and guidance on in helping us go forward in this also very challenging budget environment.
Okay, we have some calls now.
Great, let's take the first caller.
Hi there. What's the thinking about advances for what would have been the start of the fiscal 2021 year?
Michelle, are you on, and do you want to respond to that?
Hi, this is Michelle, and I'm on. I'm leaving the room so the echo goes away. I think we are intending to provide in advance. We haven't figured out all of the logistics, but it should be, there will be an advance. I just don't know if it'll be the full, I assume it'll be the 25%. There's some logistics we're working out though.
Okay, I'll go on to the next caller.
Hi, this is Albert Shelton. First of all, thank you for the support through June 30th. Much appreciated. Thank you for responding to the advanced question. The next thing as a follow-up will be when, but you guys have to sort that out, so we appreciate that consideration. The other question that I had was on PPP. So the controller sent out a statement saying that organizations that received the PPP should not be invoicing the county for expenses covered under that loan. So I think the suggestion is that the determination has been left to each department to decide. I just wanted to clarify that the PPP is not revenue, it's actually a loan. It'll be at least 5 months before to get it forgiven. And so I don't know what it means that we shouldn't be invoicing when we, because we've got a loan that we can't ask to get forgiven until 5 months from now. So anyway, just wanted your answer. I wanted the response to that. I'm sorry.
Hey, thanks, Al. This is Greg, and I'll let Michelle weigh in on that too. This one is tricky because each circumstance has its individual situation. So I think to some degree on these PPP loans, we're really going to have to just take them on a case-by-case basis and work through your individual situations with your business office and program contacts, because there are various situations where, depending on what your situation is with your loan and your contract and how those two interact. But that's a fair point that you raised. I'll see if Michelle has anything to offer on that.
That's a lot of faith. This is Michelle. I think we'll have to look at that. I mean, I guess to the degree that you did invoice the city and did get your loan forgiven, then there would be that process to figure it out, because then you would have been paid twice, if I understand how this would work, but for the same person, if you will. So I do agree we'll have to be looking at these on an individual basis and understanding more the ramifications and, to what degree you may not be getting paid back. It seemed, in my understanding, that it was a high likelihood that you would, but yeah, we should just continue to talk about this and see if we need to refine and work with the controller's office for more guidance. Thanks.
Okay, I'll take the next call.
Hi, this is Heidi Ghaffari. I have a question on DPH budget process as it pertains to not-for-profit organizations. So I understand that you are going through your budget process. We normally get a funding allocation, which tells us what the dollar amount of the contract is. I understand about the cost of doing business increase, that doesn't exist right now. But can you tell us about the timing that the providers need to abide by in sending their budgets, and at what point in time will we know what the allocated amount is?
Thanks for the question. High level talk about how that timeline works, and then again ask Michelle on the mechanics of the interactions with you as via your contract. But essentially, as we kind of went through with this timeline, everything is moved back 2 months later than usual. So the city will adopt an interim budget for July 1st, which is essentially a placeholder budget. And where we normally would have a pretty high degree of certainty around budget levels by the end of June, because that's when the Board of Supervisors would be doing its committee deliberations, and we would have seen the mayor's budget. During the months of July and August, there'll still be a lot of active decision-making around the budget process. And so we won't have that level of certainty on the timeline that we normally would. So that creates this interim period where there will be some degree of uncertainty. So DPH will be submitting our initial kind of proposed plan for meeting the target to the commission next week as we went through. And then it'll be in the hands of the mayor's office and the board for a couple of months. And so that creates this interim period of 2 to 3 months where we will be off cycle with our normal planning for the budget process. And because of that uncertainty, we're going to have some workarounds until we can get to the final final funding amounts that will be included in the finally adopted budget that should occur at the board in the month of September with the mayor's signature at the end of September or early October. So Michelle, on the mechanics to the extent that we know at this point.
Right. Hi. Okay. So I think going along with what Greg said, probably around August, September, we'll have a much better idea of what the whole budget's going to look like going forward. And that's probably when we would have official funding notifications going out. But the main goal, though, is to continue funding for all existing CBO contracts based on fiscal year 1920 funding amounts. So, you know, with whatever exceptions there are. But so if you're a not behavioral health services contract, then when you submit your contracts, you already have budgets in place. And so the contracts office can set up the purchase orders and the invoice templates and all of that, and it will be ongoing, but using 1920 funding level. So if you had a cost of doing business incorporated into your fiscal year 2021, that part wouldn't be included. But so you wouldn't, if you're not a behavioral health services contract, you probably would not have received a new funding notification because you've already submitted multi-years worth of budget. For behavioral health services, we also will work to ensure that there's ongoing funding. And the way that mechanism works is you submit annual budgets, which of course you can't because we haven't given you a funding notification, but there is a mechanism in place, which in shorthand lingo, we just call the MYE encumbrance. And that means that you'll continue to be paid based on 1920 funding levels going forward. And as soon as we have enough knowledge or detail to move forward with funding notifications, then we'll do that. And I think that'll be before the final budget is signed off on October 1st in some cases, because we'll just have the information knowing what's going to happen. But in any case, we have mechanisms in place to ensure that your funding doesn't cease between now and whenever you get your new budget documents in. Thank you.
Okay, I'll move on to the next caller.
Hi, this is Bill Hirsch with ALRP. I have two quick questions. And first, want to thank you all for your support and the work that you do. The first is whether there will be deal-ins in hearings for cuts to DPH-funded programs. And the second is, what can DPH do to facilitate getting more folks who are unhoused into the roughly 1,000 hotel rooms that the city's paying for but are empty? Thank you.
Hey, Bill. This is Greg. So on the topic of deal-ins and hearings, we will, to the extent that we have budget proposals that require that, we will have the hearings. I kind of tried to describe earlier, we're still in that process, and it's essentially 3.5 week timeline for us to figure this out. So even for our commission deadline next week, we are really actively right now still trying to figure out how we're gonna meet those targets. I will say that one of the big questions, two of the big questions in my mind are number one, how far we're going to be able to get in terms of meeting, as I kind of tried to describe those COVID program needs with existing resources. And the second big one is that contingency proposal. You saw that when Jenny went through some of the budget targets, there is the 10% in the first year, 15% in the second year, and an additional 5% in the second year as a contingency. That additional contingency in particular is really going to be challenging for us. So I think that there is a level of kind of back and forth conversation that has to happen between us, the controller's office, and the mayor's office, and a lot of moving pieces in terms of some of the things that we discussed, including how much FEMA reimbursement we'll be able to get for the things that have happened for the past several months and going forward. That will determine how far we need to go in actually moving forward proposed service reductions. But with certainty, to the extent that we need to make proposals that trigger that deal-ins in hearing, and we are trying our hardest, our absolute hardest, to minimize the need to do that. But this is a really challenging budget situation. To the extent that we have those proposals, we will have deal-ins in hearings, and we'll work with Secretary Morowitz and through our channels to let all of you know, to the extent that that is happening. We'll get the message out about that. And then on hotels, Grant, I don't know if you have anything that you want to say about that, or others on the call.
Yeah, this is Grant. Hi, Bill. Appreciate the question. So we are working very hard with HSA and HSH, who, as you know, have oversight of those hotels and who are largely responsible for the staffing outside of the medical staffing, particularly with regard to populations who are experiencing homelessness, who are most vulnerable to COVID-19, those over 16 and with comorbid conditions. We are working to ensure that they have all the information they need to get, particularly those vulnerable populations, into the shelter hotels, and filling them up as quickly as possible. Those rooms, there's a little bit of and HSA and HSH can talk about this in more detail than I can, but there is both the number of hotels that are available, the number of hotels coming online, and then the number of hotels that are staffed. So those numbers can vary day to day. But we have asked them to provide as much to house people with the chronic conditions and those over 60 in particular into those rooms as quickly as possible and are working to continually give them the data about who those people are, both people who were originally in our navigation centers and shelters, as well as now people on the streets. And then I would just also add that our isolation and quarantine hotels, those hotels that are used for people who are diagnosed with COVID-19, ensuring that we have those available for people experiencing homeless, either to be placed in those rooms directly as part of after they've been diagnosed, or from discharge from the hospital, that they have a safe and supportive place to go. So they've heard it from us repeatedly since the beginning of this epidemic that particularly with the vulnerable populations, we need to fill up every hotel potentially available with people who are most likely to suffer from bad outcomes.
Hi, this is Michelle. I just want to add to that. The human housing and supportive, I just forgot their acronym, HSH, the Department, the Homeless and Supportive Housing, they issued a solicitation that came out last Thursday, I think, or Friday, and then DPH in an email that would have come to you from Margaret Elam, E-L-A-M, we forwarded that solicitation, and that is them in combination with the other city departments trying to get bid proposals for actually staffing different components that are necessary for those hotels. So that is the challenge, is the staffing, I think. But please look out for that solicitation. It's a super tight timeline. I noticed it's due June 16th, but it came from HSH, but from DPH, look for Margaret Elam, who forwarded the email, which you would have gotten today. Thanks.
Okay, we have 5 questions remaining. I'll take the next one.
Yes, good afternoon. This is Brenda Story at Mission Neighborhood Health Center. I wanted to ask about the repurposing of staff. So we've already been doing that, and in particular doing some outreach into the Latino community when we heard that people were not social distancing. We've also proposed to do contact tracing for our own patients, and have been working closely with the primary care unit of DPH around ramping up of testing. I think one of the things that would be helpful for us, because we're getting calls from multiple sort of sides, is if as we look at repurposing staff and our COVID response, if we could have a centralized person within DPH that we can sort of channel our communication through in terms of all the efforts that are happening, I think that would be ideal.
Brenda, thank you for that. That's extremely helpful feedback. So we'll check in on you on that. I want to hear a little bit more offline from you. You're experiencing a little bit of everybody's going at 100 miles an hour on multiple projects, but we definitely want to coordinate that better and make sure that we're doing it in a systematic way. So thank you for that feedback, Brenda.
Okay, I'll take the next caller. There are 4 questions remaining.
Hi, Dave Chenok again from Progress Foundation. And as others have said, thanks for all your support during this difficult time. Just a very practical question with respect to extensions of the contract. Will we, just as a matter of course, get billing templates for July and so on? Or does something need to happen in order to generate that?
This is Michelle. Yeah, yes, you will.
Okay, we have 3 questions remaining.
Hi, this is Kent Wu with Eco's Chinese Health Coalition. if we are interested in repurposing of our staff time towards addressing COVID-19, who do we talk to about that for approval?
Hey,
yeah,
go ahead, Michelle.
this is Michelle Ruggles. We have an email address that now I'm forgetting. It's a CDTA. You know what? I will find it and send it out to this group. What we were asking in a previous meeting is that email gets used, and then we can route it. In the meantime, you could also email me, which is Michelle, MICHELLE .Ruggles, RUGGELS @sfdph.org. But I will send out an email to everyone to let you know where to send your interest, and then we'll get back to you.
Hey, Michelle, this is Jenny. In addition, should they also be looking at that RFP that went out as well?
I would recommend everybody to look at that RFP. I haven't sat down to think about and coordinate how exactly that coordinates with Department of Public Health, but it absolutely will. So I would encourage everybody to look and respond to that RFP, and then we'll coordinate back with them and with you, HSH and HSA, about and behavioral health services, how all of that fits together.
But just to be clear, in addition to that RFP, there are a lot of other streams of work that we're doing that don't touch on that, and that some of that goes to the contact tracing, those other types of streams. So look at that RFP, and there'll be other conversations to happen beyond that.
Okay, there's one more question remaining. I'll take it now.
This is Michael Gasson from Felton Institute. Like everyone else, I want to thank the SFDPH leadership team for having this meeting, and I think we're very appreciative as providers to know you're seeking our advice and asking for our input. So with that in mind, I have 3 questions. I think, Michelle, you can probably answer 2 of them pretty easily, and then one that's specific that will probably need to go to the cost reporting unit. So the one that I have with regards to the comment that was made about trying to draw down other sources of funding, particularly federal funding, Michelle, who would you direct us to do that? Because in our case, I think we are underfunded on Medicare, and we earn a lot more Medicare than what's actually in our contract. So you could replace some of our general fund with more Medicare dollars. So who would we speak with about doing that analysis and coming up with that amount and making a recommendation?
I could have told you if you'd asked about Medi-Cal, but I don't know. So why don't you send me an email and I can route it accordingly. I'd have to track down who could help with that discussion.
Okay, that's all of the callers. I see some in the queue that did not raise their hands. So if they do wish to speak, press *3 to raise your hand. Otherwise, I will clear the queue. Okay, we seem to have 2 more with raised hands. Actually, 1 more. I'll take it now.
Hi, thank you for the presentation today. My name is Vanessa and I work with the Central American Resource Center. And I'm curious about the repurposing of funding. Seeing that the large portion of COVID cases is being overly represented by the Latino community, I'm just curious how this plan to kind of move the work forward in responding to COVID-19 can meet the unique needs of this population, and how are you all working with Latino serving organizations to kind of develop this work plan moving forward, or the repurposing of this funding?
That's a good one. Do we have Tracy or John on the line from Community Branch? No on that. I see Grant.
Yeah, thank you for the, yeah. So I think they probably had to leave because we're a little bit over. But just to emphasize that we need the funding and our response to follow the data with regard to this epidemic. And we are working not only across city departments, but also with numerous community stakeholders, including the Latino Task Force on COVID-19, to better understand the needs and then to develop and invest in programs that are sustainable to address the inequities that are very apparent and that you have brought forward here. And we can certainly follow up with you with more information about that, but really committed to ensuring that those investments in prevention, testing, and care are following the data. And clearly we need to strengthen our work with regard to the Latinx population. And there's lots of stuff going on in that regard, but we can get you more specific information. And if you're not already plugged into those conversations, we'll make sure that you are.
Okay, that ends the queue. I seem to see that one caller did raise his hand again. Would you guys like to take that call, or would you like to answer the rest of this question and then have him clear the queue?
Yeah. I think we're getting past the end of our time here. So maybe if I could just ask the caller to reach out via email, and I think it might have been Michael from Felton who got a partial answer, but reach out via email and we'll answer the questions and distribute to the extent it's relevant. We're about 7 minutes over, but I just want to say my thanks to everybody for your participation, but also your flexibility as we're kind of going through this unprecedented situation together. And I know we're kind of feeling it out as we go and adapting as things change. So thank you for being with us and for all the support from all of you as partners.
And I think that concludes the meeting, everyone. Is that correct, Mr. Wagner?
I believe so. Thank you, everybody.